CNA Practice Test 525 plus Q&A for nursing assistants. Question 1. While feeding a resident, the nurse aide notices that the resident is coughing a lot after each drink of fluid. What is the appropriate response by the nurse aide? Option A. Allow the resident more time to swallow. Option B. Use a straw when giving the resident fluids. Option C. Add a thickening product to the resident's fluids. Option D. Stop feeding and ask a nurse to check the resident. The correct answer is option D. Stop feeding and ask a nurse to check the resident. Question 2. A resident with dementia tries to get out of bed without help during the night. The care plan states the resident needs assistance to get out of bed. What should the nurse aide do first? Option A. Orient the resident to person, place and time. Option B. Review how to use the call light with the resident. Option C. Tell the resident to never get out of bed without help. Option D. Try to find out if there is something the resident needs. The correct answer is option D. Try to find out if there is something the resident needs. Question 3. A resident wears a hand splint. Which observation should the nurse aide report to the nurse immediately? Option A. The resident's fingers are cold and blue in color. Option B. The splint was removed as scheduled in the care plan. Option C. The resident asks to have the splint removed for a few minutes. Option D. The resident asks the nurse aide to reposition the arm with the splint. The correct answer is option A. The resident's fingers are cold and blue in color. Question 4. Which member of the Heath Care Team counsels residents and their families and arranged for needed services? Option A. Dietitian. Option B. Social worker. Option C. Physical therapist. Option D. Activities director. The correct answer is option B. Social worker. Question 5. The goal when removing gloves that are soiled is to: Option A. Remove quickly since there is a risk of exposure of germs. Option B. Dispose of the gloves in a biohazard-safe trash can. Option C. Avoid contact with the outside of the gloves. Option D. Keep germs in the trash can area. The correct answer is option C. Avoid contact with the outside of the gloves. Question 6. Which of the following is an example of disinfection? Option A. Washing a resident's hands after toileting. Option B. Using a wipe to clean around a resident's stoma. Option C. Cleaning a shower chair with a chemical cleanser. Option D. Cleaning a resident's bath basin with soap after use. The correct answer is option C. Cleaning a shower chair with a chemical cleanser. Question 7. How should the nurse aide respond when a resident tries to talk about the recent death of another resident? Option A. Explain that HIPAA laws forbid staff from discussing residents that died. Option B. Suggest the resident talk to other residents feeling the same loss. Option C. Try distracting the resident with a more cheerful subject. Option D. Allow the resident to talk about the resident who died. The correct answer is option D. Allow the resident to talk about the resident who died. Question 8. While watching the residents in the dining room, a nurse aide notices that a resident is eating very little lunch. It is most important that the nurse aide: Option A. Check if the resident was snacking before the meal. Option B. Ask if the resident would like something else to eat. Option C. Remind the resident that dinner is several hours away. Option D. Check when the resident last had a bowel movement. The correct answer is option B. Ask if the resident would like something else to eat. Question 9. The Health Insurance Portability and Accountability Act, HIPAA, is important to the nurse aide because it: Option A. Allows the residents to carry health care from the hospital to the nursing home. Option B. Provides for insurance coverage for residents and healthcare workers. Option C. Identifies protected health information that must remain confidential. Option D. Provides accountability for care offered across healthcare settings. The correct answer is option C. Identifies protected health information that must remain confidential. Question 10. Before helping a resident to stand who has been lying in bed, the nurse aide needs to: Option A. Find out what the resident plans to do for the day. Option B. Make sure a walker is available for support in case it is needed. Option C. Ask if the resident has taken any medication recently. Option D. Allow time for the resident to adjust to sitting at the edge of the bed. The correct answer is option D. Allow time for the resident to adjust to sitting at the edge of the bed. Question 11. What should a nurse aide do with a used disposable razor? Option A. Throw the razor away in a trash can. Option B. Place the razor in a sharps container immediately. Option C. Clean, rinse, and dry the razor so it can be used again. Option D. Wrap the razor in a paper towel until it can be thrown away. The correct answer is option B. Place the razor in a sharps container immediately. Question 12. When moving a resident in bed, a lift or turning sheet may be used to help prevent: Option A. Atrophy. Option B. Shearing. Option C. Infections. Option D. Contractures. The correct answer is option B. Shearing. Question 13. A resident tells the nurse aide about being bored. The resident says, "My days seem to last forever." What should the nurse aide do? Option A. Tell the resident, "I know what you mean. My day seem long too. Option B, ask the charge nurse if the resident can have some medication. Option C, ask about activities the resident has enjoyed in the past. Option D, tell the resident to check the activity schedule. The correct answer is option C, ask about activities the resident has enjoyed in the past. Question 14. The heart is an important muscle for which body system? Option A, urinary. Option B, musculoskeletal. Option C, circulatory. Option D, digestive. The correct answer is option C, circulatory. Question 15. Residents are most likely to feel the urge to have a bowel movement. Option A, after taking a nap. Option B, after eating a meal. Option C, just before bedtime. Option D, during the shift change. The correct answer is option B, after eating a meal. Question 16. A nurse aide is assigned to provide post-mortem care for a resident, but had never done this procedure before. Which of the following is the most appropriate response by the nurse aide? Option A, ask another nurse aide to trade assignments. Option B, provide the care since the resident cannot be harmed. Option C, talk to other nurse aides about how to perform the procedure. Option D, discuss the nurse aide's lack of experience with the nurse. The correct answer is option D, discuss the nurse aide's lack of experience with the nurse. Question 17. When feeding a resident who is lying in bed, the head of the bed is raised to. Option A, make chewing food easier. Option B, decrease the risk of aspiration. Option C, improve the resident's digestion. Option D, allow for better respirations between bites. The correct answer is option B, decrease the risk of aspiration. Question 18. The nursing home is having a Christmas party. A resident who is Jewish is not interested in going to the party. The nurse aide should. Option A, remind the resident how much the resident enjoys parties. Option B, encourage the resident to go since so many other residents are attending. Option C, respect the resident's decision and ask what the resident would like to do. Option D, ask if the resident participated in any activities for the Jewish Hanukkah holiday. The correct answer is option C, respect the resident's decision and ask what the resident would like to do. Question 19. Which of the following is most important to closely observe when a resident wears elastic stockings? The type that are worn to help circulation. Option A, the resident's shoe fit. Option B, the resident's pulse rate. Option C, the way the resident walks. Option D, the color of the resident's toes. The correct answer is option D, the color of the resident's toes. Question 20. Why should residents who are unable to change their own positions have their positions changed by staff at least every 2 hours? Option A, correct resident's posture. Option B, improve the resident's breathing. Option C, promote circulation at pressure points. Option D, provide an opportunity for the incontinent care. The correct answer is option C, promote circulation at pressure points. Question 21. A nurse aide is assisting a resident at mealtime. The resident grabs his throat and cannot speak. What should the nurse aide do? Option A, try to get the resident to take a few sips of water through a straw. Option B, reach around from behind the resident to provide abdominal thrusts. Option C, pat the resident's back and then reach in his mouth to remove the blockage. Option D, ask the resident to take a deep breath and cough. The correct answer is option B, reach around from behind the resident to provide abdominal thrusts. Question 22. What is the best reason for giving frequent perineal care to residents? Option A, it increases comfort. Option B, it decreases sexual response. Option C, it helps prevent skin breakdown. Option D, it prevents incontinence. The correct answer is option C, it helps prevent skin breakdown. Question 23. To help soften the beard before shaving with a disposable razor, the nurse aide should. Option A, massage the beard area of the face gently. Option B, rub the beard in the direction of the hair growth. Option C, hold a warm, wet washcloth against the face first. Option D, lather the face with soap instead of shaving cream. The correct answer is option C, hold a warm, wet washcloth against the face first. Question 24. A resident is admitted to the nursing home for rehabilitation after a stroke. The plan is for the resident to stay only a short time before returning home. Which of the following shows the best support of the resident's needs? Option A, provide total care for the resident. Option B, set high standards for the resident's achievement. Option C, help the resident focus on even small accomplishments. Option D, remind the resident that she will be happier when she is home. The correct answer is option C, help the resident focus on even small accomplishments. Question 25. How much assistance does a resident receiving prom need from the nurse aide? Option A, partial assistance with range of motion exercises. Option B, full assistance with the nurse aide to taking the joints through exercises. Option C, minimal assistance to just remind the resident when it is time to exercise. Option D, minimal assistance to provide extremity support while the resident moves joints. The correct answer is option B, full assistance with the nurse aide to taking the joints through exercises. Question 26. A resident has returned from the hospital after a hip replacement. The nurse aide should expect that the resident will be: Option A, dependent and need total care. Option B, confined to bed for several weeks. Option C, going to physical therapy to increase mobility. Option D, receiving range of motion, ROM, exercises to hip. The correct answer is option C, going to physical therapy to increase mobility. Question 27. The first step the nurse aide should take when discovering a fire is to: Option A, check how quickly the fire is spreading. Option B, remove any residents near the fire. Option C, throw a blanket over the flames. Option D, pull the alarm. The correct answer is option B, remove any residents near the fire. Question 28. Which of the following best describes how persons affected by Parkinson's disease typically walk? Option A, they tend to walk quickly. Option B, they tend to lean back when walking. Option C, they walk normally but with some shakiness. Option D, they shuffle their feet while taking small steps. The correct answer is option D, they shuffle their feet while taking small steps. Question 29. A nurse aide is walking a resident using a gait belt. The resident tells the nurse aide she feels dizzy. The nurse aide should: Option A, hold the gait belt tighter and ask the resident to rest for a minute. Option B, suggest the resident lean on the nurse aide for more support. Option C, guide the resident over to the handrail and ask to hold. Option D, ease the resident to the floor if a chair is not available. The correct answer is option D, ease the resident to the floor if a chair is not available. Question 30. A resident is NPO because of nausea. What should the nurse aide do? Option A, give the resident fluids in small amounts. Option B, provide the resident with a small cup of ice chips. Option C, ask if the resident can handle any fluids with the nausea. Option D, remove any fluids at the bedside including the water pitcher. The correct answer is option D, remove any fluids at the bedside including the water pitcher. Question 31. According to standard precautions, the nurse aide should wear gloves for which of the following procedures? Option A, getting linen from a linen cart. Option B, removing soiled linens from a bed. Option C, performing range of motion exercises. Option D, transferring a resident to a shower chair. The correct answer is option B, removing soiled linens from a bed. Question 32. A resident is being showered while sitting in a show chair. The resident says, I feel weak. I think I am going to faint. The nurse aide's immediate concerns are calling for help and: Option A, making sure the water temperature is proper. Option B, getting the resident back to her room right away. Option C, finishing the shower quickly by washing only soiled areas. Option D, keeping the resident safe and comfortable. The correct answer is option D, keeping the resident safe and comfortable. Question 33. To help prevent residents who are confused from accidentally leaving the nursing home may: Option A, block exit doors. Option B, restrain residents. Option C, place large stop signs on doors. Option D, keep confused residents in their rooms. The correct answer is option C, place large stop signs on doors. Question 34. When a resident is dark-skinned, the first signs of skin breakdown, instead of appearing pale or red, may appear: Option A, black. Option B, green. Option C, purple. Option D, white. The correct answer is option C, purple. Question 35. Which of the following is considered a normal age-related change seen in elderly residents? Option A, increase in appetite. Option B, decrease in constipation. Option C, decrease in taste, sensation and smell. Option D, increase in amount of confusion experienced daily. The correct answer is option C, decrease in taste, sensation and smell. Question 36. A resident with dementia says, I need to get home. My daughter's school bus is coming soon. The nurse aide knows the resident is confused because her only daughter just turned 60. What is the best response by the nurse aide? Option A, let's go see if bingo has started yet. You love bingo. Option B, remember you are in a nursing home. Your daughter is all grown up. Option C, do you mean your great-granddaughter? Your daughter just turned 60. Option D, what do you like to do with your daughter when she gets home from school? The correct answer is option D, what do you like to do with your daughter when she gets home from school? Question 37. A resident, who is on bed rest, asks for a bedpan. The resident is not able to lift own hips to help with the placement of the bedpan. The best action by the nurse aide is to: Option A, ask the nurse if the resident should have a urinary catheter. Option B, turn the resident onto one side to place the bedpan under the resident's hips. Option C, place an underpad on incontinent brief under the resident to collect the urine. Option D, have another nurse aide assist to lift the resident onto the bedpan. The correct answer is option B, turn the resident onto one side to place the bedpan under the resident's hips. Question 38. While receiving personal care in bed, a resident begins to have a seizure. The nurse aide should: Option A, hold the resident down to reduce injury. Option B, keep the airway open and prepare to do CPR. Option C, call the charge nurse and remain with the resident. Option D, place a tongue blade between the resident's teeth. The correct answer is option C, call the charge nurse and remain with the resident. Question 39. When a resident is receiving oxygen, the nurse aide should: Option A, make sure the tubing is free of kinks. Option B, remove oxygen when the resident is eating. Option C, place a no visitors sign on the resident's door. Option D, limit how often mouth care is provided to the resident. The correct answer is option A, make sure the tubing is free of kinks. Question 40. A resident says she is 5 feet 6 inches tall. When the nurse aide measures the resident's height, the resident is 5 feet 4 inches. What should the nurse aide do? Option A, record the resident's height as 5 feet 4 inches. Option B, record the resident's height as 5 feet 6 inches. Option C, explain that older people shrink with aging. Option D, measure the resident again. The correct answer is option D, measure the resident again. Question 41. A resident who is Roman Catholic is dying. The resident comments that she has not been to confession and she worries that she will die in a state of sin. Which of the following is the best response by the nurse aide? Option A, don't you think God knows you are in a nursing home? Option B, would you like it arranged for a priest to visit you? Option C, sounds like you are not ready to die. Option D, have you considered praying? The correct answer is option B, would you like it arranged for a priest to visit you? Question 42. A resident reports having a very large bowel movement 2 days ago. What should the nurse aide do first? Option A, report this to the charge nurse. Option B, ask if this is a normal pattern for the resident's body. Option C, suggest the resident drink more water and increase foods with fiber. Option D, check if the resident is getting a medication to help with bowel movements. The correct answer is option B, ask if this is a normal pattern for the resident's body. Question 43. A resident has a urinary catheter connected to a drainage bag. Which action by the nurse aide shows correct handling of the catheter and the urinary drainage bag while the resident is in bed? Option A, hand the urinary drainage bag higher than the level of the resident's bladder. Option B, use the measurements on the drainage bag to measure urine output. Option C, raise the bed to the highest position for better urine drainage. Option D, wear gloves when emptying the urinary drainage bag. The correct answer is option D, wear gloves when emptying the urinary drainage bag. Question 44. When helping admit a new resident, the nurse aide notices the resident's right-sided weakness from a stroke. The resident asks for help to the bathroom. Before assisting the resident, the nurse aide should: Option A, ask how the resident went to the bathroom at home. Option B, ask the resident to wait until the care plan is completed. Option C, get instructions from the nurse about how to toilet the resident. Option D, help the resident to the bathroom immediately, supporting the right side. The correct answer is option C, get instructions from the nurse about how to toilet the resident. Question 45. A resident is choking. The first response by the nurse aide should be to: Option A, go find the charge nurse. Option B, get the suction machine. Option C, call emergency services, 911. Option D, begin abdominal thrusts. The correct answer is option D, begin abdominal thrusts. Question 46. A resident has a contracture of the right arm. When putting on the resident's button front shirt, the nurse aide should: Option A, put the shirt sleeve on the left arm first, then the right arm. Option B, ask which arm the resident prefers the sleeve to go on first. Option C, put the shirt on the right arm first, then the left arm. Option D, raise the resident's arms up to slide both sleeves on at the same time. The correct answer is option C, put the shirt on the right arm first, then the left arm. Question 47. Which foods are found on a high-protein diet? Option A, pasta and rice. Option B, meat and eggs. Option C, fruits and vegetables. Option D, whole grains and milk products. The correct answer is option B, meat and eggs. Question 48. A nurse aide is assigned to a table in the dining room during the resident's lunch. One of the residents who is seated at the table begins to have a seizure. The nurse has been called. The next action by this nurse aide should be to: Option A, guide the resident from the chair to the floor. Option B, remove the other residents away from the table. Option C, try to open the resident's mouth to check for food. Option D, keep the resident in the chair by holding around the resident's waist. The correct answer is option A, guide the resident from the chair to the floor. Question 49. Which of the following is the most appropriate schedule for residents who are incontinent to receive perineal care? Option A, in the morning and at bedtime. Option B, at the beginning and near the end of a shift. Option C, whenever the resident is soiled with urine or stool. Option D, every 2 hours when the nurse aide checks on the resident. The correct answer is option C, whenever the resident is soiled with urine or stool. Question 50. When providing foot care, the nurse aide observes an open sore on the resident's foot. The nurse aide should: Option A, pat gently to dry and cover with a dry dressing before applying a sock. Option B, stop the foot care immediately and ask the resident what happened. Option C, report the skin opening to the charge nurse as soon as possible. Option D, check the resident sick for any wound drainage. The correct answer is option C, report the skin opening to the charge nurse as soon as possible. Question 51. An alert resident has requested to be left alone with her husband who is visiting. The resident closes the door to her room. What should the nurse aide do? Option A, allow the resident to be alone with her spouse. Option B, suggest that the husband take the resident home for a visit. Option C, explain that the facility's policies do not allow for this type of visiting. Option D, remind the resident that this is a nursing home and not a hotel. The correct answer is option A, allow the resident to be alone with her spouse. Question 52. When helping a resident transfer from a bed to a chair, which of the following beat demonstrates appropriate safety techniques? Option A, place a gait belt around the resident's waist. Option B, position the chair as close to the bed as possible. Option C, signal the resident to stand by saying, 1, 2, 3, stand. Option D, follow the transfer technique as described in the care plan. The correct answer is option D, follow the transfer technique as described in the care plan. Question 53. While bathing a resident who is comatose, the nurse aide notices a reddened area on the left hip. Once reported, the charge nurse is likely to request that the nurse aide, option A, massage the area using lotion. Option B, apply a dry protective dressing over the area. Option C, keep the resident positioned to avoid pressure on the hip. Option D, cleanse the hip using extra soap, then rinse and dry thoroughly. The correct answer is option C, keep the resident positioned to avoid pressure on the hip. Question 54. Which of the following is an observation often seen when a resident is impacted? Option A, liquid feces seeping out of the anus. Option B, darkening of the resident's urine. Option C, many soft, formed stools. Option D, bad breath odor. The correct answer is option A, liquid feces seeping out of the anus. Question 55. What is the main purpose of a restorative care program? Option A, ensure the resident can return home. Option B, provide meaningful activities for the resident. Option C, help the resident improve his/her level of functioning. Option D, provide assistance with activities of daily living, ADLS. The correct answer is option C, help the resident improve his/her level of functioning. Question 56. A nurse aide is giving a resident a bed bath. Which of the following should the nurse aide do during the bed bath? Option A, keep the bed in the lowest position throughout bathing. Option B, keep the resident's body covered during the bath. Option C, open the window for fresh air during the bath. Option D, add a lot of soap to the water in the basin. The correct answer is option B, keep the resident's body covered during the bath. Question 57. It is most important for the nurse aide to check the temperature of the water before. Option A, assisting the resident with mouth care. Option B, soaking the resident's feet for foot care. Option C, giving the resident a bed bath. Option D, washing hands. The correct answer is option B, soaking the resident's feet for foot care. Question 58. Which of the following is a right of nursing home residents? Option A, to select the staff that will provide their care. Option B, to have designated smoking areas in the facility. Option C, to make decisions about their care and treatment. Option D, to have activities offered throughout the day and evening shift. The correct answer is option C, to make decisions about their care and treatment. Question 59. A resident's leg has recently been amputated. Since the surgery, the resident has not wanted to leave his room. What response by the nurse aide is most supportive? Option A, you do realize that you will look normal when you get your prosthesis? Option B, do you think you will ever leave your room? It will help you feel better. Option C, there is no reason to feel embarrassed about losing your leg. Option D, you used to enjoy activities. What's keeping you in your room so much? The correct answer is option D, you used to enjoy activities. What's keeping you in your room so much? Question 60. When a resident is unable to stand, the resident's height is generally obtained by option A, having coworkers hold the resident upright to allow for the measurement. Option B, adding the length of legs, chest, and neck/head to determine the height. Option C, asking the resident's height and subtracting an inch for age-related shrinkage. Option D, taking the measurement from head to heels while the resident is flat in bed. The correct answer is option D, taking the measurement from head to heels while the resident is flat in bed. Question 61. A few minutes before the end of the shift, a resident calls and whispers to the nurse aide, "I had an accident. I wet myself." What should the nurse aide do? Option A, explain that the next shift will assist the resident in a short time. Option B, remove any wet clothing and place the resident on a dry underpad. Option C, ask if the resident feels never uncomfortable. Option D, provide incontinent care to the resident. The correct answer is option D, provide incontinent care to the resident. Question 62. A resident says, "I am not going to eat this food. It is poisoned." What is the best response by the nurse aide? Option A, offer to taste all the food first to prove it is not poisoned. Option B, report to the charge nurse that the resident is acting crazy. Option C, ask if there is something else the resident would like to eat. Option D, leave the resident alone because the resident will eat when hungry. The correct answer is option C, ask if there is something else the resident would like to eat. Question 63. A nurse aide hears another staff member yelling and cursing at a resident. This is an example of option A, resident neglect. Option B, resident abuse. Option C, nurse aide carelessness. Option D, nurse aide noncompliance. The correct answer is option B, resident abuse. Question 64. While performing range of motion exercises, the nurse aide notices that the resident's elbow is stiff and will not bend. The nurse aide should: option A, continue exercises but move on to another joint. Option B, continue since stiff joints are a normal part of aging. Option C, apply very gentle pressure to try to bend the elbow slightly. Option D, suggest the resident see a physical therapist for the elbow. The correct answer is option A, continue exercises but move on to another joint. Question 65. When checking the resident's urinary drainage bag, the nurse aide observed that the resident has had about 50 ccs, mls, of urine output in the last 6 hours. What should the nurse aide do first? Option A, begin offering the resident fluids to drink every 15 minutes. Option B, report the observation to the charge nurse immediately. Option C, ask if the resident is having any pain when urinating. Option D, check to see if the tubing is kinked or bent. The correct answer is option D, check to see if the tubing is kinked or bent. Question 66. While helping the resident to get dressed, the nurse aide observes that the resident's breathing is faster. The resident says she feels tired. What should be the nurse aide's first action? Option A, dress the resident quickly. Option B, check the resident's vital signs. Option C, stop the dressing to let the resident rest. Option D, go to find a nurse to check the resident. The correct answer is option C, stop the dressing to let the resident rest. Question 67. When cleaning which area of the body, is it important to change the spot on the washcloth for each washing and rinsing stroke? Option A, arms and hands. Option B, abdominal area. Option C, face and neck. Option D, perineal care. The correct answer is option D, perineal care. Question 68. A nurse aide who is new to the unit observes 2 residents go into a room and close the door. The nurse aide suspects that the 2 residents are going to have sex. What should the nurse aide do? Option A, check on the residents every few minutes. Option B, report the resident's behavior to the charge nurse. Option C, ask the nurse if the residents should be medicated. Option D, tell the residents that sex is not allowed in the nursing home. The correct answer is option B, report the resident's behavior to the charge nurse. Question 69. A nurse aide enters a room to help the resident to the bathroom. A trash can in the room is on fire. What should the nurse aide do first? Option A, use the resident's pitcher of water to put out the fire. Option B, open the window to get the smoke out of the room. Option C, yell fire, alone with the room number. Option D, remove the resident from the room. The correct answer is option D, remove the resident from the room. Question 70. Sundowning is a term used to describe when residents: option A, take short naps throughout the day. Option B, show signs of Alzheimer's at a younger age. Option C, prefer to go to bed earlier in the evening. Option D, become restless and agitated late in the day. The correct answer is option D, become restless and agitated late in the day. Question 71. The nurse aide's role in assisting with a bowel and bladder retraining program includes: option A, being consistent with carrying out the toileting schedule. Option B, notifying the family that the resident has been placed on the program. Option C, determining the type of program best suited for the resident. Option D, checking the resident every 4 hours for incontinence. The correct answer is option A, being consistent with carrying out the toileting schedule. Question 72. A resident who was admitted today is sitting in a chair in his room. He asks for help to go to the bathroom. The nurse aide knows the resident's care plan has not been completed. To help the resident, the nurse aide should: option A, ask the resident to use a walker while assisting the resident to the bathroom. Option B, get another nurse aide's help to walk the resident to the bathroom. Option C, position a commode chair next to the chair the resident is sitting in. Option D, ask the charge nurse for instructions on what assistance the resident needs. The correct answer is option D, ask the charge nurse for instructions on what assistance the resident needs. Question 73. To prevent skin tears or shearing when moving the resident, the nurse aide should: option A, wear gloves to reduce friction against the skin. Option B, avoid pulling or sliding the resident when moved. Option C, tell the resident to be careful and follow directions. Option D, ask the resident to keep arms held over the resident's head. The correct answer is option B, avoid pulling or sliding the resident when moved. Question 74. A nurse aide hears the charge nurse scream at a resident. The nurse aide goes to the resident to provide immediate protection of the resident. The nurse aide should also, option A, call the police immediately. Option B, ask if the nurse is feeling stressed about something. Option C, report the situation to the charge nurse's supervisor. Option D, ask if any other staff have ever observed this behavior. The correct answer is option C, report the situation to the charge nurse's supervisor. Question 75. The nurse aide can help the resident have regular bowel movements by option A, making sure the resident gets a lot of rest. Option B, providing a routine time for the resident to toilet. Option C, giving the resident cereal for breakfast every morning. Option D, keeping a bedpan within reach while the resident is in bed. The correct answer is option B, providing a routine time for the resident to toilet. Question 76. A resident whose husband died a few years ago says, "I have got to get dinner started. My husband will be home from work soon." What is the best way for the nurse aide to respond? Option A, offer to walk with the resident to the activity department's kitchen. Option B, remind the resident that the nursing home prepares her meals. Option C, ask the resident about her husband's favorite dinners. Option D, explain gently that the resident's husband is dead. The correct answer is option C, ask the resident about her husband's favorite dinners. Question 77. When bathing a resident, the nurse aide observes that the resident's great toe is red and swollen. Which of the following is the appropriate action by the nurse aide? Option A, protect the toe by putting on an extra sock. Option B, report the observation to the charge nurse. Option C, apply an antibiotic ointment to prevent infection. Option D, soak the foot in very warm water and dry gently. The correct answer is option B, report the observation to the charge nurse. Question 78. When feeding a resident, the nurse aide notices that the resident keeps coughing after each drink of fluids. What is the appropriate response by the nurse aide? Option A, give the resident more time to swallow. Option B, keep the amount of fluid small by using a spoon to give fluids. Option C, add thickener to the fluid and see if it helps stop the coughing. Option D, stop the feeding and report the coughing to the charge nurse right away. The correct answer is option D, stop the feeding and report the coughing to the charge nurse right away. Question 79. Which of the following describes an important requirement when providing colostomy care? Option A, use sterile technique when providing care. Option B, wear gloves for standard precautions. Option C, avoid cleansing the skin near the stoma. Option D, position the resident on the side. The correct answer is option B, wear gloves for standard precautions. Question 80. A nurse aide is asked to provide postmortem care to a resident who died of natural causes. Which of the following is the most appropriate practice to follow when providing postmortem care? Option A, wear gloves, a mask and a gown when providing care. Option B, use strict isolation precautions throughout care. Option C, wash hands and wear gloves throughout care. Option D, double bag all items removed from the room. The correct answer is option C, wash hands and wear gloves throughout care. Question 81. The resident is on a toileting schedule for bladder retraining. Which of the following is the best response by the nurse aide when it is time to toilet the resident? Option A, have you been able to hold it since you last went to the toilet? Option B, how much longer do you feel like you can hold it? Option C, may I please check to see if you are wet? Option D, can I help you to the bathroom now? The correct answer is option D, can I help you to the bathroom now? Question 82. A nurse aide notices that a resident with dementia is walking with a limp on the right foot. The nurse aide's first response should be to: Option A, return the resident to bed. Option B, provide the resident with a cane. Option C, tell the nurse the resident is having foot pain. Option D, remove the resident's shoe and inspect the foot. The correct answer is option D, remove the resident's shoe and inspect the foot. Question 83. The term vital signs refers to: Option A, any important information about a resident's condition. Option B, the color, condition, and appearance of the skin. Option C, fluid intake and output, as well as bowel movements. Option D, temperature, pulse, and respirations. The correct answer is option D, temperature, pulse, and respirations. Question 84. A charge nurse asks a nurse aide to perform a task that is not a part of the nurse aide's scope of practice. What should the nurse aide do? Option A, consider if the task can be performed another way. Option B, provide the care and perform the task as best as possible. Option C, contact the ombudsman's office since residents' rights may be violated. Option D, refuse to perform the task and explain it is not within the nurse aide's role. The correct answer is option D, refuse to perform the task and explain it is not within the nurse aide's role. Question 85. A resident, who is on a toileting schedule, asks to go to the bathroom frequently. The nurse aide should respond to the resident's request by: Option A, telling the resident that is it not time. Option B, decreasing the resident's fluid intake. Option C, asking the resident to follow the schedule. Option D, taking the resident to the bathroom as needed. The correct answer is option D, taking the resident to the bathroom as needed. Question 86. When a resident's husband begins telling the nurse aide how to care for his wife, the nurse aide should: option A, accept that the husband has always been in charge. Option B, explain that the nurse aide is certified and able to care for his wife. Option C, suggest that the husband participate in his wife's resident care conference. Option D, understand that the husband wants staff aware of his wife's needs. The correct answer is option D, understand that the husband wants staff aware of his wife's needs. Question 87. Which of the following statements is true about how people experience pain? Option A, pain is usually worse in the morning. Option B, residents with dementia do not feel pain. Option C, a person's culture can affect response to pain. Option D, younger people handle pain better than older adults. The correct answer is option C, a person's culture can affect response to pain. Question 88. A resident has an indwelling urinary catheter. Which of the following is part of the catheter care procedure performed by the nurse aide? Option A, clean the catheter, starting at the meatus and moving downward. Option B, clean the catheter, starting at the end and moving towards the genitalia. Option C, disconnect the drainage bag from the catheter to empty the bag fully. Option D, cleanse around the meatus with alcohol swabs, wiping front to back. The correct answer is option A, clean the catheter, starting at the meatus and moving downward. Question 89. When preparing to shower a resident, what should the nurse aide do next after checking the water temperature? Option A, give the resident a washcloth to hold. Option B, suggest the resident wash his or her face. Option C, ask the resident to check the water temperature. Option D, check if the resident wants a partial or full shower. The correct answer is option C, ask the resident to check the water temperature. Question 90. Which of that following is generally experienced by a resident with low blood sugar? Option A, fever. Option B, weakness. Option C, sour breath. Option D, frequent urination. The correct answer is option B, weakness. Question 91. A resident falls from her chair when she has a seizure. Before the nurse arrives, the seizure is finished and the nurse aide observes the resident is breathing. What should the nurse aide do next? Option A, get the emergency cart. Option B, turn the resident onto her side. Option C, check if the resident is able to talk. Option D, help the resident back into the chair. The correct answer is option B, turn the resident onto her side. Question 92. A resident usually responds verbally to the nurse aide's greetings, but this morning the resident seems to be having trouble waking up. The resident is not talking but is breathing in warm. The nurse aide's next action should be to: option A, try to wake the resident again in a few more minutes. Option B, speak louder to make sure the resident can hear. Option C, wipe the resident's face with a cool washcloth. Option D, call for the charge nurse immediately. The correct answer is option D, call for the charge nurse immediately. Question 93. A resident is restrained. What observation should the nurse aide report to the nurse immediately? Option A, the resident states, I do not like this thing. Option B, the resident's position needs to be adjusted. Option C, the resident had suddenly become very agitated. Option D, the restraint was removed according to the care plan schedule. The correct answer is option C, the resident had suddenly become very agitated. Question 94. Areas of the body where bone lies close to the skin is known as: option A, a skin fold. Option B, a pressure ulcer. Option C, a skin breakdown. Option D, a pressure point. The correct answer is option D, a pressure point. Question 95. When weighing a resident, it is important to make sure that: option A, resident's last measures weight is available. Option B, scale measures both pounds and kilograms. Option C, resident is wearing lightweight clothing such as pajamas. Option D, scale is balanced or calibrated before helping the resident onto the scale. The correct answer is option D, scale is balanced or calibrated before helping the resident onto the scale. Question 96. A nurse aide walks into a resident's room and finds a resident on the floor. The resident says, I fell down and I cannot move my arm. What should be the nurse aide's next action? Option A, help the resident to a sitting position on the floor. Option B, ask the resident to stay still while the nurse aide calls for help. Option C, ask the resident to describe the pain and how the fall happened. Option D, support the injured arm by placing a pillow under the arm and shoulder. The correct answer is option B, ask the resident to stay still while the nurse aide calls for help. Question 97. A resident with advanced directives has a DNR order. This means that the resident: option A, does not remember. Option B, should not be restrained. Option C, does not respond to instructions. Option D, should not be resuscitated. The correct answer is option D, should not be resuscitated. Question 98. To help prevent burns to residents during meals, the nurse aide should: option A, place a clothing protector on the resident. Option B, wait to serve the food until hot food is cold. Option C, add ice to any hot liquids, such as coffee or soup. Option D, let residents know which foods and beverages are hot. The correct answer is option D, let residents know which foods and beverages are hot. Question 99. A resident reports that his wristwatch is missing. The nurse aide should ask. Option A, if the resident thinks someone took it. Option B, if the resident has checked the lost and found box. Option C, who was assigned to the resident on the previous shift. Option D, for permission to help look around the resident's room. The correct answer is option D, for permission to help look around the resident's room. Question 100. A resident tells the nurse aide that she has pain down her arms and into the jaw and that she feels nauseated. The nurse aide observes that the resident appears pale and is sweating. The nurse aide should. Option A, check the resident's arms and jaw for possible injury or bruising. Option B, check the care plan to see if the resident is on heart attack precautions. Option C, ask if the resident might have eaten something that has upset her stomach. Option D, recognize the seriousness of the signs and observations and report immediately. The correct answer is option D, recognize the seriousness of the signs and observations and report immediately. Question 101. The nurse aide receives resident assignments from the charge nurse at the beginning of the shift. When planning priorities, it will be most important for the nurse aide to: Option A, decide break times with other nurse aides. Option B, review assignments with other to check if residents are divided evenly. Option C, check all assigned residents to see if anyone has immediate needs. Option D, check what the activity department has scheduled for residents during the shift. The correct answer is option C, check all assigned residents to see if anyone has immediate needs. Question 102. Which of the following is the nurse aide most likely to observe in a resident who had a low blood sugar? Option A, shakiness or trembling. Option B, thirst and dry mouth. Option C, sweet breath odor. Option D, increased urine. The correct answer is option A, shakiness or trembling. Question 103. The nurse aide is bathing a resident and notices new swelling in the resident's ankles. Which of the following is the best response by the nurse aide? Option A, ask if the resident has been eating salty foods lately. Option B, elevate the resident's legs and check again later. Option C, report swelling to the charge nurse. Option D, avoid bathing the resident's lower legs. The correct answer is option C, report swelling to the charge nurse. Question 104. When a resident is not able to stand, the resident's height is usually measured by: Option A, having coworkers hold the resident upright to allow for measurement. Option B, adding the length of legs, chest, and neck/head to determine the height. Option C, asking the resident's height and subtracting an inch for age-related shrinkage. Option D, taking the measurement from head to heels while the resident is flat in bed. The correct answer is option D, taking the measurement from head to heels while the resident is flat in bed. Question 105. A resident who has dementia is usually able to get dressed with some prompting. This morning the resident is more confused and needs more help with all activities of daily living. What should the nurse aide do? Option A, tell the resident not to feel bad about needing more help today. Option B, provide extra help as needed to avoid the resident becoming frustrated. Option C, ask if the resident would prefer to stay in night clothes for the day. Option D, check if the resident will get dressed for another nurse aide. The correct answer is option B, provide extra help as needed to avoid the resident becoming frustrated. Question 106. When giving perineal care to a male resident who is uncircumcised, the nurse aide should: Option A, push the foreskin back to clean. Option B, keep the foreskin in place over the penis. Option C, wipe from the base of the penis towards the tip. Option D, just cleanse the tip and directly over the urethra. The correct answer is option A, push the foreskin back to clean. Question 107. A resident, who is usually alert and oriented, is having difficulty remembering where he is today. What should the nurse aide do first? Option A, increase the resident's fluid since dehydration causes confusion. Option B, consider that some memory loss is a normal part of aging. Option C, ask where the resident believes he is. Option D, report the change to the charge nurse. The correct answer is option D, report the change to the charge nurse. Question 108. Why is it important to check the feet of a resident with diabetes at least once a day? Option A, to look for sores on the feet the resident may not feel. Option B, to check if the vision problems have resulted in foot injuries. Option C, to trim the toenails so they do not become long or jagged. Option D, to make sure the resident does not get a foot fungus. The correct answer is option A, to look for sores on the feet the resident may not feel. Question 109. A resident who is in isolation needs a temperature taken several times a day. Where is the appropriate place for the thermometer to be kept? Option A, at the nurse's station. Option B, on the isolation card outside the resident's room. Option C, in the dirty utility room. Option D, in the resident's room. The correct answer is option D, in the resident's room. Question 110. If a resident is lying in bed vomiting, why does the nurse aide need to help the resident to turn onto the resident's side quickly? Option A, to get the resident into a more comfortable position. Option B, to get towels placed to protect the bed linen. Option C, to keep the vomit off the resident's face. Option D, to help prevent aspiration. The correct answer is option D, to help prevent aspiration. Question 111. Which action is most helpful to help decrease a resident's incontinence? Option A, leaving the bedpan in place for extra time. Option B, putting an incontinent brief on the resident. Option C, answering the resident's call light quickly. Option D, controlling fluid intake throughout the day. The correct answer is option C, answering the resident's call light quickly. Question 112. A resident's care plan provides the nurse aide with information about: Option A, the financial arrangements made for the resident's care. Option B, specific care required for the resident and the goals of care. Option C, facility procedures for performing different nursing care procedures. Option D, the nurse aide's assignments and when care is provided to each resident. The correct answer is option B, specific care required for the resident and the goals of care. Question 113. When counting a resident's pulse, the nurse aide should: Option A, notice if the rhythm of the heartbeat is regular. Option B, ask if the resident takes any heart medication. Option C, consider the time of day when the pulse is taken. Option D, multiply the rate by 4 if counted for 30 seconds. The correct answer is option A, notice if the rhythm of the heartbeat is regular. Question 114. The care plan requires that the resident be ambulated 100 feet twice a day at 10 a.m. and 2 p.m. When the nurse aide arrives to walk the resident at 10 a.m., the resident refuses. Which of the following is the best response by nurse aide? Option A, maybe you can plan to walk a little further this afternoon. Option B, the doctor ordered your walking exercises. You really need to try. Option C, you have the right to refuse. Do you want me to tell the nurse? Option D, would you prefer to walk a little later? The correct answer is option D, would you prefer to walk a little later? Question 115. A resident's hands shake when trying to drink liquids, causing the liquids to spill. What is the best response by the nurse aide? Option A, thicken the liquid so it will not spill. Option B, place a clothing protector on the resident. Option C, seat the resident with other residents who also spill. Option D, suggest that the resident might do well with a cup with a lid. The correct answer is option D, suggest that the resident might do well with a cup with a lid. Question 116. The nurse aide is taking routine vital signs on a resident. The resident's temperature is 101.4 degrees Fahrenheit. The most appropriate response by the nurse aide is to: Option A, place a cool, wet washcloth to the resident's forehead. Option B, cover the resident with extra blankets. Option C, record and report the change at the end of the shift. Option D, report the temperature promptly. The correct answer is option D, report the temperature promptly. Question 117. Which of the following should be reported to the charge nurse immediately? Option A, a resident's change in appetite. Option B, a resident's complaint of chest pain. Option C, a resident who refuses to take a scheduled tub bath. Option D, a resident who wanders is found napping in another resident's BRD. The correct answer is option B, a resident's complaint of chest pain. Question 118. A resident must stay in bed for long periods of time. Which of the following actions will best prevent the resident from developing pressure ulcers? Option A, put hand rolls in the resident's hands. Option B, avoid raising the head of the resident's bed. Option C, turn and position the resident according to schedule. Option D, provide range of motion, ROM, exercises every 2 hours. The correct answer is option C, turn and position the resident according to schedule. Question 119. Which of the following describes a resident's concern that needs to be reported to the charge nurse immediately? Option A, a resident's complaint of not getting to activities on time. Option B, a resident who states a need for a new pair of elastic stockings. Option C, a resident with dementia who states the need to talk to the resident's son. Option D, a resident who has always been oriented is suddenly scared and confused. The correct answer is option D, a resident who has always been oriented is suddenly scared and confused. Question 120. A resident who used to go to the bathroom by herself now asks for assistance to walk to the bathroom. What is the appropriate response by the nurse aide? Option A, assist the resident and report the change to the charge nurse. Option B, understand that these changes are just a normal part of aging. Option C, update the resident's care plan and explain the change to the charge nurse. Option D, encourage independence and suggest that the resident try going to the bathroom on her own. The correct answer is option A, assist the resident and report the change to the charge nurse. Question 121. A resident with an indwelling catheter says, I need to urinate. Which of the following is the best response by the nurse aide? Option A, check to see if the tubing is kinked and draining properly. Option B, report to the charge nurse that the resident is very confused. Option C, remind the resident this is impossible since a catheter is in place. Option D, tell the resident to try to urinate since the urine will collect in the bag. The correct answer is option A, check to see if the tubing is kinked and draining properly. Question 122. Which statement is true about the effects of aging? Option A, the aging process can be reversed with good health care. Option B, bladder incontinence is a normal part of aging. Option C, joints tend to be less flexible as a person ages. Option D, sensitivity to pain increases with age. The correct answer is option C, joints tend to be less flexible as a person ages. Question 123. When a resident has an indwelling urinary catheter, the nurse aide should expect that the resident's care plan will include: Option A, limiting activity by keeping the resident on bed rest. Option B, emptying the urinary drainage bag every 2 hours. Option C, keeping the area where the catheter enters the body clean. Option D, toileting the resident every 2 hours for bladder retraining. The correct answer is option C, keeping the area where the catheter enters the body clean. Question 124. Which of the following is the best example of using reality orientation for a resident with early dementia? Option A, your son plans to visit today at 2 p.m. Option B, you are in the nursing home. I am here to help you. Option C, this is your daughter Anna. Do you remember her? Option D, look at the time. Lunch is in 30 minutes. Are you feeling hungry? The correct answer is option D, look at the time. Lunch is in 30 minutes. Are you feeling hungry? Question 125. When a person is receiving end-of-life care, the resident's care plan is likely to include: Option A, ways to best provide for the comfort of the resident. Option B, exercises to help improve the resident's strength. Option C, frequent observation to help prevent confusion. Option D, instructions for providing postmortem care. The correct answer is option A, ways to best provide for the comfort of the resident. Question 126. After reporting the observation of a red area on the resident's hip, the nurse aide should expect that the: Option A, resident will be placed on a short-term bed rest. Option B, area will be covered with a protective dressing. Option C, area will need frequent massage with a moisturizing lotion. Option D, resident should be positioned to avoid pressure on the area. The correct answer is option D, resident should be positioned to avoid pressure on the area. Question 127. The nurse aide notices that a resident with dementia keeps walking over to the piano, pausing there, touching the piano, and then walking away only to return again. Which of the following is the best action for the nurse aide to take? Option A, take the resident back to the resident's room. Option B, distract the resident by asking about the resident's family. Option C, invite the resident to sit down at the piano with the nurse aide. Option D, ask the activity director to find something for the resident to do. The correct answer is option C, invite the resident to sit down at the piano with the nurse aide. Question 128. While eating lunch, hot tea splashes on a resident's hand. The nurse aide's first response should be to: Option A, quickly move the resident to the nurse's station. Option B, ask the resident how badly the burned area hurts. Option C, wet a towel or napkin with cool water and place against the injured area. Option D, apply antibiotic ointment to the burned area and then cover with a bandage. The correct answer is option C, wet a towel or napkin with cool water and place against the injured area. Question 129. A resident must have assistance to walk. When leaving the resident in the resident's room, what must the nurse aide do before leaving the room? Option A, turn on the resident's television. Option B, make sure the resident's bedpan is within reach. Option C, place the call light where the resident can reach it. Option D, say to the resident, remember that you need help to walk. The correct answer is option C, place the call light where the resident can reach it. Question 130. When a resident wears a restraint, the nurse aide must make sure that: Option A, resident is wearing an incontinent brief. Option B, resident is checked once every 2 hours. Option C, restraint is applied following the manufacturer's instructions. Option D, restraint is applied tightly and placed under the resident's clothing. The correct answer is option C, restraint is applied following the manufacturer's instructions. Question 131. Which of the following best describes the daily routine needs of residents with dementia? Option A, is it important that the resident's day is kept full of activities? Option B, changing daily routine is often helpful to residents with dementia. Option C, providing opportunities for activity and periods for rest is important. Option D, following a strict schedule is required to decrease confusion. The correct answer is option C, providing opportunities for activity and periods for rest is important. Question 132. A nurse aide finds a resident who has a history of falls lying on the floor in the resident's room. The resident is crying and says, I fell again. What should the nurse aide do first? Option A, call for help while keeping the resident calm. Option B, check for injuries while asking how the resident fell. Option C, place a pillow under the resident's head and cover with a blanket. Option D, consider if the resident is trying to get attention. The correct answer is option A, call for help while keeping the resident calm. Question 133. Which foods are found on a high-protein diet? Option A, pasta and rice. Option B, meat and eggs. Option C, fruits and vegetables. Option D, whole grains and milk products. The correct answer is option B, meat and eggs. Question 134. A nurse aide enters a room to help the resident to the bathroom. A trash can in the room is on fire. What should the nurse aide do first? Option A, use the resident's pitcher of water to put out the fire. Option B, open the window to allow smoke to escape. Option C, remove the resident from the room. Option D, yell fire, along with the location. The correct answer is option C, remove the resident from the room. Question 135. When caring for a resident who is comatose, the nurse aide is expected to: Option A, provide mouth care once a day. Option B, avoid changing the resident's position. Option C, talk to the resident while providing care. Option D, keep the resident's room dark and quiet. The correct answer is option C, talk to the resident while providing care. Question 136. A resident likes to eat breakfast in the dining room with other residents. The resident is slow when getting dressed each morning, so the resident's friends are often leaving when the resident gets to the dining room. The nurse aide should: Option A, set out clothing that the resident can dress in more quickly. Option B, dress the resident to make sure the resident gets to breakfast earlier. Option C, ask if there is any help the resident would like in the morning. Option D, remind the resident that the friends will also be at activities later. The correct answer is option C, ask if there is any help the resident would like in the morning. Question 137. A resident is scheduled for a morning shower but is refusing to take one. The best response by the nurse aide is to: Option A, explain that the shower is required to keep clean and healthy. Option B, try to motivate the resident by collecting clothing and supplies. Option C, ask if the resident has another preference for bathing today. Option D, remind the resident, you do have the right to refuse care. The correct answer is option C, ask if the resident has another preference for bathing today. Question 138. The nurse aide is to obtain a resident's weight. The nurse aide should: Option A, ask if the resident remembers his/her last weight. Option B, ask when the resident last ate food or drank fluid. Option C, wait until after the resident has a bowel movement. Option D, check what scale is usually used for this resident. The correct answer is option D, check what scale is usually used for this resident. Question 139. The normal appearance of urine is: Option A, clear. Option B, cloudy. Option C, dark yellow. Option D, strong smell. The correct answer is option A, clear. Question 140. Which of the following actions helps to prevent skin tears? Option A, keeping side rails raised. Option B, using less lotion on the skin. Option C, sliding the resident up in the bed. Option D, dressing the resident in long sleeves. The correct answer is option D, dressing the resident in long sleeves. Question 141. A resident has an indwelling urinary catheter. When the resident sits in a wheelchair, where should the nurse aide place the drainage bag? Option A, on the floor directly next to the wheelchair, positioned well below the resident's bladder. Option B, tucked at the resident's side on the seat of the chair to keep the drainage bag level with the resident's bladder. Option C, hung from back of the wheelchair so that it is out of the resident's view and above the bladder. Option D, attached to the seat of the wheelchair, positioned below the level of the resident's bladder. The correct answer is option D, attached to the seat of the wheelchair, positioned below the level of the resident's bladder. Question 142. The purpose of a gate or transfer belt is to: Option A, limit physical contact with ill residents who are transferred or walked. Option B, protect the nurse aide's back when walking or transferring a resident. Option C, help steady and support a resident when transferring or walking. Option D, allow residents to transfer or walk independently. The correct answer is option C, help steady and support a resident when transferring or walking. Question 143. A nurse aide enters a room just as a resident's wife slaps the resident. The resident does not seem upset or hurt. What should the nurse aide do? Option A, leave the room and close the door to allow privacy. Option B, consider if this is normal behavior for this couple. Option C, report the observation to the charge nurse immediately. Option D, tell the wife that she must leave the facility for the day. The correct answer is option C, report the observation to the charge nurse immediately. Question 144. When going to take routine vital signs, the nurse aide discovers that a minister is praying with the resident. The nursing aide should: Option A, ask how long the minister plans to visit. Option B, explain politely that it is time to take vital signs. Option C, check if the resident is praying before interrupting. Option D, wait to take the vital signs after the minister has left. The correct answer is option D, wait to take the vital signs after the minister has left. Question 145. A nurse aide is assigned to a resident with Alzheimer's disease. The nurse aide notices that today the resident is restless and is pacing a lot. The resident is also observed running his stomach. The nurse aide should report this change to the nurse and option A, ask the resident when he had his last bowel movement. Option B, check if the resident is hungry or needs to go to the bathroom. Option C, try to keep the resident close to observe the resident throughout the shift. Option D, allow the resident to move around as long as he does not harm other residents. The correct answer is option B, check if the resident is hungry or needs to go to the bathroom. Question 146. While helping in the dining room, the nurse aide notices a male resident in distress holding his throat. The nurse aide believes the resident may be choking. After calling for help, the nurse aide's next action should be to option A, check the resident's ABCs. Option B, ask if the resident can talk. Option C, provide an abdominal thrust. Option D, lower the resident to the floor. The correct answer is option B, ask if the resident can talk. Question 147. A resident with a feeding tube is scheduled for a shower. The resident's feeding tube is connected to a pump. Which of the following is the appropriate response by the nurse aide? Option A, disconnect the feeding tube temporarily to give the shower. Option B, protect the pump with a plastic bag before bringing into the shower room. Option C, ask the charge nurse for assistance with the feeding pump. Option D, give the resident a bed bath since the resident has a feeding tube. The correct answer is option C, ask the charge nurse for assistance with the feeding pump. Question 148. A resident who must stay in bed is at risk for develop. Option A, dementia. Option B, arthritis. Option C, foot drop. Option D, Parkinson's disease. The correct answer is option C, foot drop. Question 149. A resident who is wearing a hearing aid keeps asking the nurse aide to repeat information. Which of the following actions should the nurse aide do first? Option A, speak loudly and directly into the hearing aid. Option B, check that the hearing aid is in the correct ear. Option C, ask when the hearing aid battery was replaced. Option D, make sure the hearing aid is turned on. The correct answer is option D, make sure the hearing aid is turned on. Question 150. The use of a physical restraint helps. Option A, control a resident's behavior. Option B, protect the resident from injury. Option C, make staff members' jobs easier. Option D, decrease how often staff need to check the resident. The correct answer is option B, protect the resident from injury.